everybody, and thanks for joining the Early Childhood Colorado Partnership Lunch and Learn, the first Lunch and Learn of 2016. And we're going to go ahead and get started and jump in on today's Lunch and Learn on Early Childhood Mental Health Consultation. And I'll provide a little bit of background on the Early Childhood Colorado Partnership who's hosting the webinar today. I noticed a lot of people who were registered are names I didn't recognize, which is great. So want to definitely jump right in, but just provide a couple talking points on what the partnership is and provide a link to our website so you can go find out a lot more. So the kind of idea behind the Early Childhood Colorado Partnership is that there are many, many people working across the state, all working for the best outcomes for young children and families, but developing and sustaining a strong, comprehensive early childhood system for children and families at the center, where children and families are at the center, is not an easy task, and no one individual agency, organization, or entity can do it alone. It takes all of us coming together to make that happen. And so the partnership functions as a network of over 600 partners now, from state and local agencies, nonprofits, early childhood councils, foundations, and universities that are committed to advancing the vision of the Early Childhood Colorado framework statewide. Really, the partnership provides the space and conditions for diverse partners across the comprehensive early childhood system, across physical, mental, behavioral health, family support, early learning, to come together and identify common results and share best practices together to move progress forward on behalf of children and families in Colorado. So I'll stop there and talking about the partnership, but if you want to learn more about the activities we're taking on, including other lunch and learns and that kind of thing, and action teams and meetings, you can go to www.earlychildhoodcoloradopartnership.org. Some very quick background on how the lunch and learns kind of work. We'll keep everybody muted for the entire session, since there's so many people logged on. And so if you have questions at any point, there will be a specific time later in the panel to field questions from people. But if you have questions, you can type them as they come or wait until the question time. There's a little question box in your kind of webinar dashboard, and you can type them in the chat box there, and we'll field them as we're able. And we'll save a few minutes at the end if we have time for questions as well. And if this is about our 5th or 6th Lunch and Learn webinar that we started last year. So there are a few archived and recorded that you can go watch and listen to on the partnership website as well. So for now, I just want to jump in and let people go. So I'm going to pass it over to Sarah Davidon. She works with JFK Partners, and she is also a steering committee member for the Early Childhood Colorado Partnership. And she'll kind of introduce the kind of panelists who are here with us today to share more about early childhood mental health consultation and provide a little bit more information.
Thank you, Hannah. Thanks, everybody, for joining this webinar. It's exciting to see and hear how many people are interested in this, in the topic of early childhood mental health consultation and the development of an infrastructure, which is what we're going to be talking about today. I'm very privileged to have some of the really good thinkers in our state around a table with me right now, who are going to be presenting as well. So I just wanted to do a quick run-through of who's going to be on this webinar today. I am Sarah Davidon, and I'm with JFK Partners at the University of Colorado School of Medicine, and have been working on early childhood mental health issues for the past 15 years or so in Colorado. We've got Amber Minogue with Minogue Consulting, Betsy Rogers with Aurora Mental Health Center, Lauren Jasso with Community Reach Center, and Jordana Ash with the Colorado Office of Early Childhood. So it's really exciting to have this conversation with all of you today, and we want to make sure we go through some things that I think will help sort of kickstart some of the work that we've been doing around early childhood mental health consultation in our state, and that the Office of Early Childhood has been very kind of invested in and supportive of. So the goals for today, we want to make sure that we get dig a little bit deeper than where some people might have gone before in webinars and conversations about early childhood mental health consultation. This isn't going to be just a review of what mental health consultation is in early childhood. We really want to dig a little bit deeper into the conversation about a sustainable infrastructure and what would it take to really make early childhood mental health consultation a viable long-term strategy that's fully supported in our state. We want to also discuss the concept of building a hub, which is very related to the development of an infrastructure. So we're going to talk about what some of the elements are that would be needed if we're, as a state, going to move forward with the concept of an infrastructure and a hub. The essential elements of that hub. We want to have a community perspective. We have two people here, Betsy and Lauren, who are going to be giving us a community perspective on the value added to communities of early childhood mental health consultation and an infrastructure at the statewide level to support that. We'll have an opportunity for questions and answers, as Hannah mentioned, but certainly if anybody needs clarification as we're talking, then feel free to type in the chat box and we'll try and get to those clarifying questions. And then we want to tie it all together. What else is happening in the state? And there are also some pretty exciting national efforts too that Jordana will share a little bit about and hopefully whet all of our appetites for what the next steps are moving forward for us as a state and also what we can do as part of a national effort. So a little bit of background on where we are now with the sort of this concept of an infrastructure and sort of where we've been. There had been a partnership with the Office of Behavioral Health and JFK Partners. And for those really old timers like me, there was an initiative called Harambe, which was looking at the supporting the caregivers of early childhood, the mental health of caregivers as well, and the Kid Connects initiative. And we had developed a Blue Ribbon Policy Council for Early Childhood Mental Health. Out of that work, in 2008, formed a subcommittee specifically focusing on early childhood mental health consultation. The purpose of that was we as a state have had a pretty good long history of early childhood mental health consultation, going back to I think the early to mid 1990s when the early childhood, the child care pilots, as they were called in the 1990s, were formed and now have evolved into the early childhood councils. But Colorado was one of the first states to really try and embed mental health consultation and the idea of mental health supports and consultation into early care and education settings. So we've got a good history of that, and the Blue Ribbon Policy Council recognized that and developed a subcommittee to prioritize mental health consultation in our state and specifically trying to develop a sustainable infrastructure. As that work was happening, the State Department of Human Services showed an investment in early childhood mental health by funding the Early Childhood Mental Health Specialist Program. So that was a really significant leap, I think, towards building an infrastructure around early childhood mental health consultation in our state. The specialist's role is to provide services in a consultative model. We've made a lot of significant progress in awareness around what mental health consultation is, the value added of it to both providers, to families, and to children. An acceptance of mental health consultation as a valuable practice. National efforts have not only been informing, but have been supported by the work that we've done in Colorado. So Colorado has actually served as a model with the Kid Connects initiative, but also I think we've been learning a lot with the national efforts that have been going on around early childhood mental health consultation. We're embedding related best practices into early learning settings. The work of the Mental Health Consultation Initiative that we all here are presenting are a part of has also been part of bigger efforts around how do we make sure that we're embedding other supports into our early childhood system. So mental health consultation is a piece of a bigger system. So things like positive behavior support initiatives in early care and education programs, professional development, teacher training, teacher supports, all of those other things that are needed to support young children in early care and education settings are critical. So we've also been working on some of those things. An example of one of the things that we've accomplished over the last few years is we were the group that worked on embedding changes into the child care rules and regulations, specifically supporting children's mental health and social emotional development. So both in the family child care rules as well as in the child care center rules that just passed the state board this month. Last month? This month? Last month. What year is it? So that was I think that was a really significant move forward in how we, as our mental health consultation initiative, has worked to support other initiatives, other practices, not just mental health consultation, because we are a part of a bigger system. So we want to talk about this concept of an infrastructure. What will it take? So some of the things that we wanted to start with are understanding that mental health consultation as an initiative in and of itself is a very powerful initiative. But in Colorado, we do have the Early Childhood Mental Health Specialist Program, and the Office of Early Childhood has been very supportive and invested in trying to expand that to support other people in our state who are doing mental health consultation. But what we really still need is consistency, workforce development, sustainability, quality, and accessibility for mental health consultation. And so as we move forward in the webinar today and as we move forward in our work in Colorado, we want to keep those things in mind. So why a hub? A hub could offer a statewide collaborative, accessible infrastructure to support the work of all of the people around the state who are doing this kind of work. We want to be able to house best and evidence-based practices and be able to share and gather that information so that as individual practitioners, it's not as much of an individual effort, that instead we can have a group effort to gather best and evidence-based practices. Central training and support, a registry or a database of mental health consultants, and all of this is, there's nothing set in stone about how this would work, and that's why we're having a conversation about it. And then better accessibility to higher education programs for workforce preparation, specifically embedding sort of a consultative approach in the pre-service education that is offered in higher education. So I want to introduce this the document that we developed for recommendations for an early childhood mental health consultation infrastructure. Hopefully you all have seen this as part of the preparation for this webinar, and if not, we'll make it available again.
Yeah, it was emailed to everybody yesterday, so if you registered between yesterday afternoon and today, you might not have received it, but we'll send it again in follow-up emails for sure.
Yeah. So this is just to give you a taste of it if you haven't seen it. About how pretty it is, because we don't have the page 2 to show you right now, but we're going to talk about page 2 because that really includes a lot of the in-depth points that we want to talk about the infrastructure development. So I'm now going to turn it over to Amber Minogue, who is going to go through some of those infrastructure elements that we have as a group and also have vetted with many others in the state that really have emerged as sort of the strongest elements that we need in order to support a sustainable infrastructure. So Amber?
Thank you, Sarah. So I want to talk a little bit about these essential elements, and our group has really honed down and vetted out 8 essential elements that we believe are important when thinking about infrastructure development. And I think all of them will be pretty familiar to everybody sitting at the table because you're all a part of this system already, and the elements that we come up with are elements that you will find in any sort of early childhood system. The first one that I want to talk about is collaboration across systems, and we know in early childhood that it really touches the face of all different systems: human services, child welfare, education, health, mental health, corrections, workforce development. So when you're thinking about building a system and building an infrastructure, you want to ensure that you have collaboration and partnership across systems, and you have voices at the table that include all of the agencies that I just spoke of. But you also need to think that you want to ensure that there's a mechanism that you have decision makers at the table as well, and public and private partnerships. So having policymakers, but then also having the business community. And at the end of the day, you want to make sure that the people who are receiving these services are giving input to the system as well. How are they being impacted? What are the types of things that they need? So you really need families, and you need children, and you need centers to be at the table. And you want to think about the system from where it starts to where it ends. So having state-level providers, having state-level agencies, having community-level providers, community-level agencies, and then having site-specific providers and stakeholders like families, daycare directors, mental health consultants, coaches, mentors, etc. With evaluation and monitoring, it's sort of a core of any kind of quality infrastructure, and it's an essential piece to sustaining any system. When you think about evaluation and monitoring, it's important not to add too much extra work to the people who are going to be delivering the services. So developing a standardized tool or practice around evaluation for mental health consultation is important for communities to consider, so they're not reinventing the wheel, and so that when people are talking to each other about impact, they're comparing apples to apples, and they're collecting data, and they're evaluating service delivery in the same manner. It's also sort of thinking about the longer, bigger funding and sustainability. You want to be able to talk about larger impacts, and you need to have a way that you can prove that you know about those impacts. So building into the data systems that you already have, technology that talks to each other, and evaluation that is consistent and standardized. In any good system, you have to think about financing, and that's a complicated subject, and it's not just inclusive of fundraising, it's also a consideration of how we're going to sustain this over the long run, and that could be anywhere from setting up a fee structure for how we're going to pay for mental health consultants with different abilities and serving different populations. For example, our group likes to recommend that mental health consultants, when working with 0 to 3, have the infant mental health endorsement. And so when you think about differentiating pay structures, are you going to pay a different amount of money for a mental health consultant who has the endorsement, or a different amount of money for mental health consultants who are working in the preschool and school-age children? And so there are policies around that that we need to consider. There's also policies around barriers to financing. So making Medicaid reimbursement, for example, more accessible to providers and to mental health consultants to use that as a resource for funding mental health consultation. And then finally, there is sort of the element of fundraising and thinking about what types of fundings exist at the state level and in your community in order to pay for mental health consultation. And some of the state funding streams that have been used by programs across the state and should be considered include Child Care Development Block Grant, the Mental Health Block Grant, the Maternal Child Health Grant, Part B, Part C, Child Welfare, TANF, and other general fund dollars. But it's also something that you can bring in the business community at your local level. It's something that you can think about how we're partnering with our mental health centers in our communities, at our community level agencies that they can contribute, and what types of philanthropic community we have that's committed to the cause of mental health and social emotional readiness. So looking at governance and administrative structure, this is where we really think about the hub. When you look at what's going on in mental health consultation across the state right now, there isn't a central hub, but there are a lot of people and a lot of things happening, moving at the state level to help bring together some of these system elements that we're talking about, including standardization and resources and cross-communication and collaboration. And what's important when you're doing this at the community level, but what is also being built at the state level, is thinking about what's going to govern this, and a hub is a great place to have all of this place to come together to coordinate the collaboration, to coordinate the financing, and to coordinate the policies in tracking the barriers, tracking the evaluation, and disseminating the standardization around the practice. Moving on to public will, and if you think about any infrastructure development, sometimes one of the biggest challenges we have is knowing first about the things that exist in our community to address these challenges. But then once we have made some sort of awareness in our community about strategies, it's how do we find the financing, how do we do the policies we need to build public will. Some of the elements that help towards building the public will is doing things like changing our language around behavioral challenges in early childhood. Instead of using behavior challenges, looking at this and using mental health. All language is that important to be used, but destigmatizing that language so that families and caregivers don't feel like they're entering something bad when they enter the mental health system. But it's also important that once you build awareness that you build some advocacy around that. So again, getting back to that collaboration and that system building, who's involved at the table that can be change agents in this, and who can be your advocate for making the changes and the development necessary once you have sort of the awareness built across your community. Services and supports is very important when you think about building an infrastructure. This is the space where the hub can deliver consistency for your workforce. This is a place where they can house things like templates and documents for resources and contracts, and who are the providers in our state, and what kind of professional development do we offer, and if I'm a program and I want to start up bring in a mental health consultant, what kind of understanding do I need to have with my mental health consultant, and are there just contracts that exist that I can borrow or tweak or whatever. So services and supports are going to be the thing that really supports the delivery of the service, the mental health consultants, and that's where the practice is going to come from, and that's where the I don't know what the word is I'm looking for, but that's where
the power.
That's where the power is for making sure that everybody's working together on the actual delivery of services. It's sort of where the rubber meets the road and the implementation of the infrastructure. Technology and data, I'm sure everybody is tired of hearing about this across their systems, and so that's why when you think about employing technology and data around mental health consultation, I think it's very important to consider the technology and data you already have in place. Again, not recreating the wheel, but figuring out how you can utilize technology to collect data around what's going on with mental health consultation that doesn't duplicate what you're collecting for other programs, but then also can help enhance the information that you have about the service delivery and about the overall mental health wellness in your community. So when you think about what kind of data you're collecting, it's also important to think about what types of systems already exist that you can enter that data into, and make sure that the technology systems can talk to each other so that you don't have daycare centers entering into 3 different systems, 3 different types of data that are duplicating the same information. And then finally, there's workforce development, and that really is thinking about a model of practice that we can infuse in higher education so that people have access to training and curriculum around how to become mental health consultants and how to work with mental health consultants, but also then increasing access to that, because we do have some training that exists across the state, but it's much harder to access when you're in rural areas than it is to access if you're here in the Denver urban center. So if you think about how do we expand the higher ed opportunities in our partnerships so that it's disseminated across Colorado, but then also trickling down once we're trained and we had the higher education, how do we get the hands-on training? And so what types of opportunities can we offer in our communities for internships and practicum experience so that we know that when we're applying the practices, they're being applied in a way that is true to what mental health consultation is looking to do. So with that, I want to pass this on to 2 women who have a great sense of how to incorporate this infrastructure into practice. This one passes on to Lauren and Betsy.
Pardon us for any noises. We shift the phone around. There's 6 of us cozily gathered around a table in here, so it's lovely, but might make for a little bit of noise as we shift.
All right. Well, thank you, Amber. Hi, I'm Lauren Jassel. I'm the manager of Early Childhood Services at Community Reach Center in Adams County. And what Betsy and I wanted to talk a little bit about today is taking this idea of the infrastructure and the elements that we've been talking about, that Amber's been talking about, and really talk about what does it look like on the ground level for us. And you know, you see the first slide. Our slides are all pictures. We're happy to share any of the actual word slides later, but we wanted to showcase what our message is in pictures. We feel like that this is a really powerful way to do that. And just to start off, you know, we really feel that professions that are valued and respected in our society have an infrastructure in place to support them. So if you look at the left column, you see a doctor, you see a lawyer, maybe someone just graduated law school, and there's a sense of infrastructure around those positions. There are regulatory bodies, there's lots of training and different pieces around that education. And we don't necessarily see that with early childhood mental health consultation. There's all those lovely little faces on the right-hand side and those teachers supporting each other. But in this work, we don't have the same infrastructure that may exist in other professions. And our big question is, how does the consultant know that they're important and valued when their job is not recognized in the structure of a system?
This is Betsy Rogers, and I work with Aurora Mental Health Center and have worked in infant mental health and early childhood mental health for a long time. And I'm happy to be here talking about this infrastructure. And as Lauren set the stage, is that infrastructure is essential for recognizing and developing the importance of a position that we know makes a difference and we know is valued when people are engaged with it, but many people don't have access to or don't understand. Both Lauren and I have done lots of supervising, hiring. I've spent time in child care centers as a mental health consultant, and in thinking about that, we thought about what are the things that we do as managers and directors. What do we need in place at the ground level, as Amber was talking about, where the services and supports happen? What do we need in place in order to do well there at that ground level? And similarly to some of the elements in the infrastructure, we felt that the first thing we need for any position that we hire is funding. The second thing that we need is trained workforce to hire. We need a process for hiring, and then we need to be able to supervise and support. So we're going to talk about these basic functions that in our typical mental health world are fairly straightforward and become complicated as we try to work with mental health consultation because of the lack of the infrastructure. So the first area we're going to talk about is that funding area. And on the left, you'll see that our typical mental health therapist has a pretty direct source of funding. We bill Medicaid, we bill third-party payers for direct services to children who have mental health needs. We have a diagnostic process and we have a recognized funding source. When we look at our early childhood mental health consultant side, we have multiple different funding sources. I love the pig hands all putting nickels into the piggy bank, because sometimes it does feel like that. The funding is not consistent. The funding is usually time limited, which when you're trying to develop a service becomes really difficult for both the people that hire and supervise, but also for the child care centers who start to depend on a consultant and then find out that the grant is over and the program is gone. Another issue I was thinking about related to the technology and data collection, I think the first grant we got for consultation was in 1999. So we have 16 years of consultation services. And aside from our pilot projects that Kid Connects was part of, we have no consistent data because every year the new funding source also had new ideas about what data to collect and how to collect that data. So although we have a lot of data over those 16 years, it's not data that we can compare. So I think that infrastructure is another place where data can be helpful. And where the funding plays into this is that each funding source likes to say, oh, I think we'll use this, this tool. No, let's use that tool. And if you don't have consistent funding, you don't have a consistent data collection process. The other thing is that at the agency level, our systems don't integrate our mental health consultant. There's no way for them to really show the work they do so that we can request the funding that we need. So it becomes kind of a double-edged sword. So Lauren, you've had experience with this.
Yes, definitely. On our team at Community Reach Center, we have 4.5 full-time equivalent staff who are early childhood mental health consultants in different capacities. And just amongst those 4.5 staff, We have 4 distinct funding streams, and then lots of other ones sort of blended and braided within to sustain. And so we have what we call those funding streams, but really behind the scenes we know that there's a lot more in place to sustain those. Oftentimes it's a last-minute scramble to go for a new opportunity that's just exposed itself and everyone's excited to jump on board. And then it's also collaborating across centers. So is Betsy's team at Aurora also going for the same funding that my team at Community Reach is going for? And we know that we're all doing really great work, and we'd rather not be having to compete for those funding sources, but to be able to work together. And as Betsy was saying, with each funding stream comes different requirements about documentation and evaluation, and it's hard to manage. It's hard to explain to staff the importance of what's happening with funding and how they play into it, and how their work is so vital to the sustainability of the work and of the funding streams, because we're literally proving what we're doing and the importance of it each and every day, so that we can continue with this funding and be able to continue to support this work. So that brings us to moving into hiring. If you look at the image on your screen, you see that the hiring process for a mental health therapist is pretty straightforward. We definitely find that it can be challenging to find somebody who has young child experience. But as long as you've got some kid-related experience, you've got a passion for working for young children, and you have experience in the mental health field, we can get you hired and trained and geared up to go as a mental health therapist. In terms of consultation, it's a little bit different. It's a different set of skills around prevention and capacity building, around engaging relationships in a way that almost sometimes feels like doing in-home work, because you're in the teacher setting, you're in another environment that is a lot more dynamic than being in the office and trying to just do one-on-one therapy. We know that when we're hiring somebody who's a therapist, they've been trained by a public institution that has a lot of regulations around it and expectations around what I should get. Whether I'm hiring a marriage and family therapist, a counselor, a social worker, I pretty much know what skill set they're coming with. They've done internships, all of those pieces. And they know expect in the work with me because they've done those internships and they've had those opportunities to practice the skills. I don't know that I've ever come across somebody who's had an internship in early childhood mental health consultation. They've maybe had an internship within a child care setting or within a school, and they have a sense of what it's like to be in a classroom, but not so much having done the direct work itself. We know that we can hire therapists who have a child and family focus. They've taken classes in that. They've had discussions and internships around that. But it's very different when we're hiring for consultants. I'm actually in the process of doing that right now, and it's interesting to see what comes across my doorstep. People see the word consultant, and I've gotten resumes from business. So they see the word consultation and they think, a business field. Or I've gotten people who maybe have only direct care experience in a child care center but don't have the mental health piece, or vice versa. And it's exciting for me when I get a resume from someone who has both mental health therapy experience and maybe during their undergrad years worked in a child care center for a couple of years, and they know what it's like to be surrounded by 20 screaming 4-year-olds. That's the person that I want to
Happy
do.
4-year-old.
Yeah, happy, excited, screaming with happiness. And so it can definitely be very, very difficult. It takes more time for the manager to hire for these positions, because I found that if I don't do at least a phone or email screen before I bring them in, it's sometimes a waste of the interviewee's time and my time, because they just don't quite know what the position is.
And this is Betsy again, and when we advertised recently, we had the same concerns that Laura's spoken about. Our own Human Resources Department, instead of putting the advertisement on the Colorado nonprofit site as a mental health position, put it under the other category, and we were getting all of these odd applicants, again, around business people who wanted to provide consulting to us, and teachers who had no mental health experience at all. And when I looked at the posting, I couldn't find it. And I went back to my HR department and they said, oh, we listed it under other. Is that a mental health position? So even within my own agency, there hasn't been enough recognition of that role for people to really understand what it is. So I don't even really know where to send the notice for the job. I actually sent out a blast email to every colleague I could find, just hoping that somebody could pass it on to someone who would know what mental health consultation was. And it's also, the one fun thing about it is that if somebody walks in the door with mental health consultation experience, you know it right away, because they know exactly what it is they've done that's different from other kinds of mental health roles. So we're going to look at training and supervision here next. And again, as Lauren mentioned previously, the pathway for early childhood mental health therapists is pretty direct. Even though there's not a lot of focus on early childhood in our professional training organizations, there is child development courses, there is specific mental health training, there are internships and field experiences that put people into contact with at least kindergarten in the school systems. There are licensing guidelines for each discipline, and we have the endorsement, which really looks at mental health, the infant mental health specialist, and what kind of competencies are needed. For our mental health consultant, again, you see the mix of resources. Where do they get training on consultation? That's a completely different perspective. And often we get applicants who really want the direct contact with the children, and they go into the centers and we're saying, you need to be talking to the teacher and the director, but I'm a therapist, I need to be playing with the kids. So really how to help people understand the consultative stance. Where to get early childhood experience. As Lauren said, if I was designing an early childhood mental health consultation program, the first thing would be that they spend a full semester in the classroom with the kids, because it's a totally different experience. And what ends up happening is the program manager or the direct supervisor really has to support all the training needs.
Definitely, and my experience in the work has been right on par with what Betsy's been talking about, and I'll be honest, I've been at this position for 2.5 years, and when I started in this role, I didn't even know what consultation was. It wasn't something that was part of my social work experience. I had done outpatient therapy, I worked in a child care center myself, but I hadn't heard about consultation, and so there's very much a learn as you go sort of process with consultation, and so often, we as the supervisors, if this isn't work that we've done before, had experience with, we're learning while simultaneously teaching, and we're all learning together. All right, so we wanted to end with talking about support. If you look at the picture on your left, it's very collaborative, they're all together. There's a very direct process by which we record our information, we report it, and then you look on the right, it's either quite isolating, even though she does look quite comfortable in that chair, but it's isolating, or it's this web of, this data going to this place, and this support person, and this system, and there's not a clear sense of who is my support, what is my support network, and how am I getting those needs met in terms of support. And even in rural communities, especially in rural communities, but even in a Metro Denver area, there's not necessarily a team of people who are doing the same type of work. And so consultants are very much working independently quite often, or they're having to create their own systems of support. I know that we partnered with the other local mental health centers for a while just to meet up quarterly and just say, how are things going, what's your work like, what's my work like, but it's something that the team had to come up with on their own. And as my team has grown and the number of consultants has grown, we've set up an every other week consultant group supervision, which we're lucky enough to have a staff who's trained in reflective supervision, and she leads that group for us. And so this really gives that opportunity for my consultants on my team to reflect on their work. It creates some checks and balances to some extent. So, what are what does it look like when you do the work versus what it looks like when I do it, and how do we learn from each other and continue with best practices. But it's very much something that has to be created, and that initiative has to be created on your own because there's not a larger system around it.
And that's on our team. This is Betsy again. On our team, we actually have 2 people at 0.5 each who are doing the consultation work. So they're within a larger team. The total team has 12 people. So they feel pretty isolated. They feel that their work, they worry that their work is not captured in our electronic record, that it doesn't show up on our productivity reports. And they also are not able to bring the dilemmas of their work to the team. The team doesn't really understand what it's like to go into a child care center and establish relationships and sort out all of the things that you have to do as a consultant. So again, as Lauren said, we've tried to connect with other mental health centers and develop a small group of supportive consultants. That takes a lot of extra time and travel time and energy that most of our consultants don't really have. So one of the things that we're curious about, and maybe you can do during the question and answer period, is just what your experience is with consultation, what you would hope to get from an infrastructure, what you already do that maybe provides an informal infrastructure, and how we can all translate our knowledge and our experience into a real infrastructure that can really grow this tremendous capacity building intervention that we know helps kids in a very direct way.
And so now we're going to turn it back over to Hannah for a question break.
Yeah. So we'll pause before we hand it over to Jordana to take it home in a few minutes. But it looks like we have kind of a comment from Matthew, who says he thinks of it as kind of an apprenticeship. So any reactions to that or?
Absolutely, Matthew. It's a total apprenticeship model, and the only breakdown there is that sometimes the person who is supervising the team doesn't have the experience to be the apprentice leader. So on our early childhood team, our very capable and experienced mental health manager does not have the specific consultation, and so there's the breakdown for that apprenticeship for the team.
Which is one of the reasons, hello everybody, this is Jordana, and I would just comment that it's one of the reasons that we're thinking so deeply about having an infrastructure, so that those of us who may have leaders or people who can lead an apprenticeship kind of an activity can be available to those who don't, and to other communities and regions in our state where that support and expertise is not available. Having an infrastructure provides for all of us and sort of a level playing field and access, equal access to the kinds of supports and services that we want.
For those who might have questions, if you can type them into the question box or in the chat box, either way, we can answer them. I said at the beginning we're not able to unmute people just because it's a little bit messy with so many participants, but add your questions in as you want, and we'll give people a minute or so to ask questions. One question I kind of want to throw out, and this might be taking a few steps back a little bit, but thinking about people who might be on the webinar, who may be working in a child care center or other kind of provider arena, who might be thinking about early childhood mental health consultation and what that might look like in their program. Does somebody, I'm not sure which one exactly wants to take that on, but just talking about what that might look like. And so that might be taking a little bit of a step back, but what that might look like.
So what it might look like for a child care center to invite a consultant in? Okay. You want to answer that, Jordana?
Sure. I'd be happy to. You know, it's really fascinating to think about engaging in that kind of a relationship. It takes some courage on actually on both people's part, right? On both parties' part. The child care center to open themselves up and say, you know, I think we could use some help. We're interested in infusing social emotional practices throughout our day, or I have some particular children that I'm concerned about, and what does it take for me to work with a consultant and have someone come and have us share and work together to figure these things out. Because that's what I'd like to emphasize for those of you who may not be as familiar with the practice of consultation, is it's really considered an indirect approach, meaning that the mental health consultant is not going to be taking a child out of the milieu, doing something sort of secretive or magical with the child, and sending that child back to the classroom all fixed. Really, it's a collaborative relationship. There's mutual goal setting of what the program, the child care facility is interested in working on, and what the consultant brings as far as expertise. So mental health consultants do have a wide range of experiences, and they have a depth of expertise, but really what's important is what the child care providers know about the children, know about the relationships in their program, and together they share, they collaborate, and they share their thinking, they share their best understanding about what kids need and how to puzzle through concerns or challenging behaviors, and really how to support the child care providers who are doing this very important work hour after hour, sometimes with very little training, sometimes with little support. Sometimes our child care providers come from very challenging environments themselves, and we want them to be able to provide the healthiest, emotionally safe relationships for those young children who are in their care. And so oftentimes the mental health consultant needs to care for the caregiver.
And I would just add, it looks like we have some other questions, but I would just add to that too, that part of what we're hoping could happen if we get a sort of a solid infrastructure in place is that would make the process of accessing a mental health consultant a little bit less scary and a little bit less of this sort of overwhelming, I don't even know where to start process.
Great point. So we have a question from Jennifer Richardson around regarding field experience. You mentioned classroom experience, which makes sense in some situations. What about when using mental health consultation in home visitation settings, and wouldn't field experience be pretty important in a home setting?
Definitely. So this is Lauren. So through Project Launch in Adams County, we have a new consultant who works primarily with home visiting programs. It's been a really exciting shift in that our consultants have been primarily in early care and learning centers. But definitely, so she was even harder to recruit and train for. We called her our unicorn. We also wanted her to be bilingual. And so, you know, to find somebody who had experience and comfort and knowledge around doing home-based work was definitely hard to find. But, you know, just like consultation in early care and learning centers, her focus continues to be around capacity building and competency of those home visitors. So helping one-on-one with the home visitors in the office, doing team consultations. So that position, I think, was definitely it needed for a wider range of skill set. But it's a really exciting opportunity, and we're glad we found her. Lucked out.
And we have just a couple more minutes for questions, so I'm going to try to go through these quickly. From Lacey Rubik, it sounds like in Weld County, are the 17 people already in place, and will there be somebody for just Weld County who will be paying for their services? And that could be maybe a follow-up question if we need to follow up directly with her afterwards. But
sure.
Quick answer now.
That sounds like an early childhood specialist.
So there have historically been 17 FTE positions. Sometimes they're filled by up to about 25 individuals because some of those positions are shared, and they are located in the regions that are covered by or bounded by the mental health center region. So for example, in Boulder, it covers Boulder and Broomfield County. For you, Lauren,
Adams County.
It's Adams County, so that would be the mental health specialist who covers that area. Weld County covers a couple of different cities, and it's trickier there on the Eastern Plains because counties and school districts cross county lines, and so it's a little bit, the regions are defined and bounded by what is covered historically by the mental health center geographical parameters.
And then one more question and a comment, but are there, from Tamara Keeney, are there other ways to professionalize the position outside of offering certificates, and are there existing programs out there like that?
I don't know of any training program, for instance, in all of the mental health training programs in our universities in the metro area. I don't know of any of them that provide specific classes on early childhood mental health consultation. The only training that I know that's direct is workshops that the postdoctoral fellowship program of the Irving Harris Fellowship offers some training in consultation in general, not specific to early care and education settings. Does anybody here at this table know of any specific training?
To my knowledge, there's not a program that specifically trains early childhood mental health consultants. As Betsy mentioned, there are a smattering of classes or coursework on occasion that different psychology programs will have, or school social work programs might have. There's some analogous training to being a school social worker in terms of the consultation approach. But it's a conversation and an issue that's being discussed at the national level to do some sort of a maybe a certificate program that has a collection of courses, because of course it's more detailed than just one class on how to be a consultant.
And that's why in our, this is Sarah, and in our kind of infrastructure elements that we've come up with, that we really sort of thought through the professional development one and included higher education in there as one of the strategies for professional development for building up capacity for mental health consultation, because it's really hard to piece together every time somebody wants to be a mental health consultant, to piece together what that professional development means, as opposed to having at least some sort of parameters around, oh, here's what that means, here's what the professional development looks like, and that's semi-consistent across consultants.
Mm-hmm. Yep, and so I'll pass it over to Jordana. Want to just add one comment from Bev Thurber up in Larimer County, that we really like the comments you've made about the involvement of ECE providers and working in the ECE setting. Would also love to see a focus on teaming, which could also involve parents and ECE coaches. So with that, I'll pass it over to Jordana. And if you have any questions that you want to add, even if we don't get to field them through the webinar at the end, we might be able to follow up with you personally, or maybe go over just a couple minutes at the end. But with that, I'll kind of pass it to Jordana to take us home.
Thanks, Hannah. So I have the good fortune of being able to give you a couple of highlights from the Office of Early Childhood and then kind of wrap us for today. But what I would say is that we are so excited that there's so much interest in this topic. Those of us who have been around this table for a while have really sort of kept the torches burning for this idea of its infrastructure, because we're so passionate about mental health consultation as an effective approach. And we want to share this, we want to bring it to scale in Colorado as one of the very important pieces of our early childhood system. So I want to just highlight a couple of things that are happening out of the Office of Early Childhood. As Sarah mentioned, I'm the Early Childhood Mental Health Director, and very honored to be in that position, because this is this moment in time when so many elements are coming together to really bring progress to this work and to help us be very successful in ways that many of us have been thinking about for a long time. So to that end, what I want to just touch on very briefly is the office's emphasis on mental health consultation in both child care and home visiting. So we have two substantial programs in those different arenas right now. And you heard briefly about the consultation in child care. Currently there are 17 funded positions that are funded through state general fund dollars, and those positions are deployed out to the regions that are covered by the mental health centers. 14 of those positions still exist in the mental health centers, and there are 3 in community organizations, community-based organizations. The consultation to home visiting is a newer approach, and our home visiting unit, which includes the nurse-family partnership, and our MICV, which is the maternal infant early childhood home visiting program, they have really thought deeply about how to bring mental health consultation to their home visiting teams. It's recognized as a really important approach, and it's an approach that helps those home visiting teams better achieve the goals and meet fidelity to those individual home visiting programs when they have access to a mental health consultant, somebody who's trained in early childhood mental health, and he can help those home visitors think about the interactions that they're seeing with their parents and the young children, and how to foster the social emotional development of the children, and think about ways that the adults' mental health concerns may be impacting that child's development. So there is a strong program now underway to bring that mental health consultation directly to home visiting. One of the resources that I'm going to have Hannah share with all of you is an infographic that was developed last year by a group of national experts in early childhood mental health consultation that cuts across both child care and home visiting, and helps describe what the competencies, training, and research are about consultation in these 2 settings. So I'm going to have her share that, because it's a really handy document to have when you're talking to your communities about building consultation in and the importance of it. Many of you on this call probably know that the Child Care Center rules were just adopted in January, as Sarah mentioned, and there's 3 certain sections that I wanted to emphasize that have something to do with mental health consultation and fostering social emotional development for young children in child care. First of all, 3 of the child care providers' continuing education hours need to be focused on social emotional development, and that training can be delivered by the mental health consultant that they have access to, or received in some other kind of setting. There's also an emphasis on access to consultation, to a mental health consultant. How are providers going to reach out into the community and access a consultant if needed? That's one of the child care rule changes. And we wanted to set the stage for child care providers to partner with mental health consultants or other behavioral supports and parents to think about children who are presenting with challenging behaviors, and prior to any kind of removal of that child, to be working together and have a plan of action that slows everyone down and helps us think about the meaning of that child's behavior to stabilize that placement. I'm getting the sort of eyebrows raised here because I really want to respect your time, so I'm just going to emphasize a couple other things. The new state plan for the Child Care Development Block Grant has greater emphasis on social emotional support and the reduction of limiting child care suspensions and expulsions, and I encourage you to look at the state plan that's now open for public comment. I also wanted to let all of you listeners know that the Department of Human Services has a supplemental request before the legislature currently that will that sets out to double the size of the mental health specialist state system. That legislation has not passed. It's under consideration, but what that is asking for is really spending authority to be able to increase the size of the mental health specialist program. So what we recognize is that if we push on one side of the system with our child care rules that says child care providers need to access a specialist, we need to build the supports in on the other side of that system, which says, and here's our system of support. Here are more specialists that you can access to help improve your programs and to work together collaboratively. And then finally, I wanted to bring everyone's attention to the recently funded National Center of Excellence for Infant and Early Childhood Mental Health Consultation. That work is just getting underway at the national level, and this first year will be focused on developing resources like the ones that we were all talking about specifically for Colorado. But these are going to be national resources available to states, tribes, and territories to help systems, states develop systems of support and of consultation. So I think we are really well ahead of the game in terms of our thinking around our infrastructure, what we need, but we are going to be able to tap into this national center as they develop and disseminate best practices in consultation. So in closing, what I would say is get involved with us. Reach out to Sarah Davidon if you're interested in hearing more about what we're doing and lending your energy and your expertise to our work group so that we can make a great case to decision makers, policy makers, and funders to get this infrastructure off the ground, because we know that it's going to result in great outcomes for children, families, and child care providers. Thank you very much.
Thank you. And we'll send a follow-up email to everybody that includes all the resources, these slides, and the recording and everything. So thanks for joining today, and thanks to our presenters who came in and gathered around this tight table to share more about early childhood. Right at the end, I'm losing my voice.
She's choked up about how good we were.
I am. So thanks for joining.